Welcome to the class of medical physics. In the previous lecture, we have discussed about, we have started the topic of electrical safety measures while using any biomedical instrumentation. And in the previous lecture, we have discussed about the basic AC wirings at commercial level and what are what are electric shocks and what could cause electric shocks to the human body. Continuing with that lecture, in this video, we are going to discuss how a shock can affect the human nervous system. Nervous tissues are the tissues basically that offer very little resistance to the passage of an electric current. Again, because you have a liquid amount present into your nerve tissues. When nerves are affected by an electric shock, the consequences include pain, tingling, numbness, weakness, or difficulty in moving a limb. These effects may clear up with time or that could remain permanent. Electric injury can also affect the central nervous system when a shock occurs because the victim may be dazed or may experience amnesia, seizure, or any such respiratory arrest. Long-term damage to the nerves and the brains will depend on the extent of the injuries, of course, and may develop up to several months after the shock. This type of damage can also cause psychiatric disorders because they are slow but prolonged. They are slow but have prolonged effect. That is why. A shock can have other unexpected consequences as well, like other than the circulatory system damage and nervous system damage. They have uh, some other harmful consequences on human systems. The other disorders can appear in the weeks or month following the shock, depending on which organ the current passed through. For example, if the current passed through the eyes, cataracts may develop over the time. Here is a pictorial representation of a normal eye and a cataract eye. You can see in a normal eye, you have a point where the image is forming at the level of retina, whereas in a cataract eye, you have a blurred vision because image is not forming, or the light coming to the entering the human eye is not gathering at a point of retina, is not collecting at that specific point. However, it is being dispersed throughout the level. Okay, causes of electric shocks and precautions. Some of the causes of electric shocks include faulty appliances, damaged or frayed cords or extension leads, electrical appliances coming in contact with water, incorrect or deteriorated household wiring, down power lines, lightning strike, and so on. Few are the safety tips while using these electrical appliances around the home. You can reduce the risk of getting electric shock by few precautions, including first of all, always hire a licensed, trained electrician for all type of wiring jobs. Do not use extension leads or applying if the cord are damaged or frayed. If any wire is um, frayed means if it is being um, it has any damaged part, or it is being um it's the plastic of that wire has been removed. Don't remove a plug from a power point by pulling on the cord. Pull the plug instead. Just do not pull the cord, right? Keep all the electrical appliances away from wet areas. For instance, many of the people have they practice using the electrical appliances in their on their wash basin level, so avoid using that. Have safety switches installed by an electrician, buy portable power boards with built-in safety switches, insert safety plugs into PowerPoint not in use to stop children from inserting object into them. This is one uh, very much very much needed thing whenever you have a children at your home. Effect of electric current on human body. Electric shock is a physical effect and a violent response to electrical current that enters the body. After an encounter with the electric current, there are primary electrical injuries which indicate tissue damage. Electric current is able to create severe burns in the body. The reason is hidden in the power dissipation across the body's electrical resistance. Shock can cause cardiac arrest, burns to tissues and organs, muscle spasm, serious effects to the nervous system, and other unexpected consequences. Other disorder may include and appear in weeks to month following by the shock, depending on which organ is being exposed. However, internal burns are devastating and often have serious consequences, including amputation, scarring, and loss of sensations. For instance, if a lot of tissue is destroyed, the large amount of waste generated can cause serious kidney problem or blood circulation disorder because the body organ do not function properly in that case. Cardiac effects are among the most serious and among the most common electrical injuries. The issue is that the electrical heart's central anatomical location in the chest, and it's more commonly affected than other internal organ because the electric current usually flows the path of least resistance in the body along the blood vessels and nerves because they have a huge amount of liquid contents directing the current towards the heart. Arrhythmias is basically exposure of high voltage current when it is likely to cause cardiac stall, but even low voltage AC can cause cardiac arrest through ventricular fibrillation. The mechanism behind induced cardiac arrhythmias is predicted to be internal damage to heart muscle and subsequent scar formation leading to any abnormal electrical activation to the heart. Bradycardia are the injuries can result from interference with the normal conduction system. The sinoatrial and atrioventricular nodes responsible for impulse generation and propagation within the heart may be more susceptible to damage as a result of electrical injury than the other cardiac cells. Heart muscle injury, the chest pain may be absent in this case, and injury may manifest only as a non-specific electrocardiographic changes, but the increased level of myocardial proteins in the blood troponin form tissue damage. So occasionally, uh, mostly after high voltage accidents, myocardial infarction can be caused by occlusion of coronary arteries by blood clots or muscle spasms. The blood vessels, in this case, the walls of blood vessels through which a current can pass long enough to cause necrotic changes, become brittle and friable. The inner endothelial lining of the vessels undergoes changes, and parietal thrombi can attach to the enigma. Neurological damages could include the nerve tissue because of lost consciousness, impaired cell impairment, okay, spinal cord injury, paralysis, and loss of sensations in the limb can all cause neurological damages. The eye observed on the eyes are usually late compilations of the electrical injury. They do not have direct impact to the human eye. Musculoskeletal system, in some cases, the electric arc can burn a deep hole in the bone and the meninges and the brain too may got affected. In other cases of the less severe types of accident, the bone is often exposed by the destruction of the soft tissues. So bone fracture and luxations, direct muscle damage can also compartmental syndrome. Next are the techniques to reduce the effect of electric shocks. Inspect electric cords for fraying. If you see a crack in any insulation, repair it or replace it immediately. Cords can be frayed if they get moved a lot and are exposed directly to the sun. That could cause a melting effect to them or are chewed by any animal. So if you have them for a long time, go for their replacement. Do not plug too many things into the same outlet because that outlet could get overloaded and can have some serious effects. Replace all older two-prong outlets. All outlets in the home should be of three-prong types. It is not safe to use adapters that allow you to plug a three-prong appliance into a two-prong outlet for an extended period of time. Insert plastic safety caps in all unused electrical outlets, again, to keep away from the children. Keep all electric appliances away from the places wherever there is water, such as a sink, toilet, and any bathing tub. Avoid using electrical appliances near any water place, wet surface. Check electrical outlets used near sources of water, such as bathroom sinks, hot tub, spa, or swimming pool. All such outlets should be special type known as ground fault circuit interpreter outlet. Keep electrical appliances, outlets, and light bulbs away from flammable liquids or products that produce vapors. Make sure that all power tools are grounded or double insulated. This means there is an extra barrier between you and the electricity. Make sure that children do not play or climb near electric lines or on a power pole where the lines enter into the house. Stay clear of electric power lines when you are trimming trees or using gardening tools. Do not handle fallen wire ever. Report fallen wires to the police or local utility right away. This is your responsibility. So if you are in a car and a wire has fallen onto it, stay in the car and drive away if you can. Do not touch any metal part in the car until the electrical source has been removed. If you cannot drive away, you do not get out of the car, call or wait for the help. Electric shocks and precautions against the earth shocks, that is earthing. Earthing is an apparatus causing safety precautions against earth shocks. Sometimes insulation on live wire become worn. The wire come in contact with the casing. If apparatus casing is not earthed, connection between casing and the earth complete that circuit. If the connection is through a person, he receives an electric shock very easily. So by correcting the earth, when live wire gets contact with casing, current can pass by the earth wire. This can cause a pathway of low resistance. The current flow could be huge. Fuse on live wire blows. This is stop current flows, giving a warning of defect. So precautions against the earth shock is the proper arrangement of physiotherapy department. Proper flooring should be done with Rexin. Proper insulation should be there. Whereas on treatment, during treatment, patients should not touch any machine part. Metal casing should be connected to earth and floor should always be kept dry. Thank you very much. This is end of the lecture. See you in the next one. Take care.